For someone who wants to know about autism in details, I will be going into very specific things about autism, and I will not talk vaguely about autism. So in this particular video, we will discuss autism from DSM-5 point of view. What is DSM-5? DSM-5 is Diagnostic Statistical Manual, and in this manual, autism is defined for everything that autism includes. So once you know autism from DSM-5 perspective, it means that you know autism as it is known to professionals. So someone said something about autism, someone said something about autism, so it becomes very difficult for a parent or for someone who is having autism to actually understand how autism is. So we will go through the most important things that we need to understand to know autism. So let us go through DSM-5, and we will discuss other aspects and other things about autism in different videos. So let us stick to DSM-5 for this particular video. I've got a PowerPoint presentation, and I'll present DSM-5 very precisely in simple possible. So what is autism? It is a neurodevelopmental disorder. Neurodevelopmental meaning it affects the development of brain. By saying development of brain, I don't mean that brain has formed not right, but brain is not learning in the right way and it is not developing in the right way. So it is a neurodevelopmental disorder. It affects social communication in the person, it affects social interaction in the person, and it results in a behavior pattern which is very restricted and repetitive. It affects all racial, ethnic and socioeconomic group and is very commonly seen in boys than in girls. So there are some common issues which are seen in all the children with autism, that they have problem with the social, emotional and communication skills of the person. They repeat certain behaviors and they don't like change in their routines at all. They have different ways of learning and paying attention to things. And the signs of autism begins earlier in the childhood and it will last throughout the person's life. There are some indicators of autism. Indicators meaning there are some behaviors or some pointers which are very similar in everyone who is having autism. Like they don't like pointing of the objects and they don't show any interest when somebody is pointing at something. They have difficulty in understanding what other person's behavior are or what their intentions are. They don't look when somebody else is pointing at something. They have difficulty in giving eye contact, so they avoid eye contact. They want to be alone. They don't like when somebody comes and cuddles them, but they may come and cuddle you suddenly. It all depends if that person having autism wants to do it. If he or she wants to do it, then there is no stopping to them. They can do anything they want. They are very interested in people, but they don't know how to talk or how to play or how to relate to them. They will repeat certain words and phrases said to them again and again, and they will not use their speech in a fluent language form, but they will keep on repeating certain sounds or certain words again and again. They have difficulty in expressing what they feel, and they don't involve themselves in pretend play type of situation. Pretend play means some children behave like they are Superman and they are Spider-Man, but children having autism cannot imagine themselves as somebody else or cannot pretend to be something that the play requires. So they have difficulty in pretend play. They repeat certain actions over and over again, and they have trouble when something changes in their routine. They have unusual reaction to certain sensations, and we will get into the details of those things in upcoming parts of the video. And whatever skills they have learned once, they tend to lose those skills. Like they must have learned to speak at some point of their development, but then they forget whatever they had learned in their speech, or they may learn to do something and they forget how to do that. Let us now come on the 5 categories of DSM-5. All of these 5 categories have certain rules. So if a child is falling into these categories, only then he is labeled autism. So if you are in the process of finding out whether your child falls into autism, I would suggest that whatever is presented in this video, whatever I am talking, just understand these 5 categories and see if your child is falling in all of these categories. So let us begin. So the first category is deficits in social communication and social interaction. In the first category, you have to only concentrate on the fact of your child's behavior in social situations. So the first is social emotional reciprocity. So instead of making things so complicated, I'll just give you some examples so that situation is very clear. When I say social emotional reciprocity, it means that the person having autism will have difficulty in initiating the conversations, in continuing the conversations with somebody in the social situations. The person will have difficulty in sharing objects, in sharing some emotions. Like everyone is happy, he has to be happy, and he has to understand that why everyone is happy. So that sharing of emotions, objects, initiating communication, continuing communication, all that is affected under first point. In the second point, we are talking about non-verbal communicative behavior, where a child fails to understand the non-verbal aspect of somebody's conversation. He will not understand why it is important to look into eyes or give eye contact to a person during talking. He will not give eye contact. He will not be interested in other person's body language. He will not try to predict what the person's body language might mean to him in that situation. He will not understand gestures, or he may be least interested in gestures. He will not understand somebody's tone of emotions, or he will not understand how the situation is, whether everyone is sad or everyone is happy or joyful. So he will not be able to adjust in the communication pattern of the surroundings. The third thing is developing, maintaining and understanding relationships. In this category, the person or the child does not understand the point of social relationships. The person does not seem to be interested in making friends. He's not interested in expressing in right manner, a way he should express according to his age. He will not be cooperating with others, and he will have absence in the interest of others. He will not be interested in what others are interested in. He will not be able to make social relationships. He will not be able to maintain whatever relationships he is having, and he will not understand how relationships work. He will not understand how to adjust his behavior according to the situations. So this is where the person is having difficulty in category 1. We have to understand that we have discussed 3 symptoms in this category. One is social and emotional reciprocity, second is non-verbal behaviors, and third is social relationships. So the person should have difficulty in all of these 3 to qualify under this category. Then only you can say a person is having category 1 deficits present. We'll go on second category. So let us talk about the second category. In the second category, there are 4 points to be taken care of, and out of the 4, child should be showing at least 2 things in his pattern to be qualifying into this category. So the first point is stereotyped or repetitive behavior. In this, the person is either using his motor means body, to do same action again and again, or he will speak something again and again, or he will make a particular sound again and again, or he will do something like this, teeth grinding again and again, or beat his head again and again, and he will use one thing for one movement only, like he will take a pen and keep on moving, or he will take a rattle and keep on banging. Something he will do again and again. In the second point, he will have insistence for sameness. He will want same routine every day. He will have a particular set pattern of verbal or non-verbal behavior. Like he will say same thing again and again. Mama, can I take it? Mama, can I take it? Mama, let's go. Mama, let's go. Something like that. But that will be same and he will not like any change into that. The third thing is he will have highly fixed interest into something, and the intensity of focus, the amount of concentration he puts into those things is very abnormal. Like he will keep on watching the fan, he will keep on spinning the objects, and he will keep on doing one thing, and he will focus on that thing for unusual amount of time, and the child should be doing it on a regular basis to be qualifying into this third point. The fourth thing is hyper or hyporeactivity to sensory input. So there are some sensations which are frequently discussed in occupational therapy when it comes to a child with autism. There are 7 to 8 sensations. We will talk about those sensations in later videos, but the child will have abnormal amount of sensory response. You will give him little bit of touch, either he will run away, or he will not like it, he will cry or something like that. And sometimes what happens, the child is not at all responsive. You give him any amount of touch, any amount of pressure, he seems to be not bothered or not registering it. So more about sensations we will talk in different video, because it is a huge topic. So out of this 4, at least 2 should be present for the child to be able to qualify into this category. The third is symptoms must be present in early period, like before the age of 3 or 2 years the child should have these problems. Only then you can call that the person is having autism. But it can happen that parents will not notice that he is having autism at this early age. Only when he grows and the demands over him increases, like he has to attend to the school, he has to play in the ground, and he is not able to do that, then parents come to know. But the symptoms or the picture is seen from very early stages of development. I mean his age, like 2 years or 3 years. The fourth thing is symptoms, when they are all taken together, should affect his everyday functioning. The child should have difficulties doing his day-to-day task. Only then you will say that this is qualifying for the autism thing. The fifth is that whatever deficits we have spoken about in all of the 4 categories up to now should not be because of anything else, like intellectual disability or some other disorder or anything else. It should not be because of any other reason. Only then we can say that these things are because of autism. So this was about how DSM-5 classifies or categorizes the picture a child with autism shows. So if you want more details, you can leave your message and I will try to answer your questions. But see if your child is falling into all 5 of this, then only label him autism. If he shows 1 or 2 out of these many, then he is not autism. So this was about DSM-5 and autism, and there will be more videos on autism discussing different aspects of autism. To know about other things, subscribe to my channel and keep a check if I am posting any video on autism. If you want me to put video on specific topic about autism, let me know. I will try to help you as much as possible from occupational therapy point of view.